I've always been a tech geek and really passionate about data. To me, I like to think of data as a bit like, the dot-to-dot drawing books that we had when we were kids. And the more dots that you've actually got on the page to connect up and draw, the clearer the picture is that emerges. And for me, that's what data is like. It's dots on a page, and the more of those dots that we can collect up, join together, the clearer the picture is that emerges, and the greater the insight into what a patient's actually experiencing and how we can best help them emerges. I think the biggest changes that have occurred over the last 10 years in the way technology is used in the pharmacy sector really relate to the way that our patients are actually accessing information and expecting to have their information accessible. From a pharmacy perspective, we were one of the first professions to actually computerise back in the 90s. We all switched to electronic dispensing systems. Our records have actually been digital for a very long time, and we're used to working with digital data. The big change now, though, is that our patients have actually gone digital as well. They're coming into our pharmacies with their questions already answered by Dr. Google often, and just wanting to get our advice and I guess our interpretation of that information. So we need to really be thinking about how we're managing the patients who are already so much better informed, but also too how we're actually sharing the information back with them that's previously probably been quarantined into our clinical systems within our four walls of our pharmacies. To get us started down this pathway, you don't actually need to be a tech geek. Most of us have got iPhones, most of us use apps in our everyday life. If you can use something like Facebook or Instagram, you can use something like the kind of apps we're talking about. They're built to be very user-friendly. That said, if you do find it really challenging, pick someone else on your team to actually be your champion. Having those conversations, I guarantee there will be people in your pharmacy who are already using health management apps, and if you actually empower them to do that, to work on this as a project in your pharmacy, could be a really great staff engagement piece as well as a patient engagement one. I think moving forward, the opportunities for pharmacies to engage with their patients via conversations around their data are really interesting. Patients are capturing so much information about themselves now through the Internet of Things, through devices, sensors, wearables, things like the watches, and that type of information is creating this pool of data that has really interesting ramifications in the management of their health, both in terms of looking at how they're managing specific health conditions, how some of the behavioural changes and medication changes that they're implementing are actually impacting and progressing, and also even potentially alerting to looming challenges in their health before they're actually even occurring. In 2025, I'd love to think that community pharmacy is still a vibrant, community accessible health portal where we have that extraordinary benefit of being the most accessible of all the health professions. Most of our pharmacies are open extended hours, 6 or 7 days a week. Patients can walk in, see a health professional without an appointment. I think the ability to incorporate data into those conversations only increases the richness of the experience that we can provide, and so will see us play a really significant role as the face-to-face interaction of the bigger healthcare conversations.